Good morning, everyone, and welcome to the October meeting of the Kansas Children's Cabinet and Trust Fund. My name is Don Heineman. I'm the chairman of the committee. As most of you know, we normally meet by Zoom, but last October we tried an in-person meeting, and there was some consensus that that kind of made sense to get together in person one time a year. And that's not a small thing. I know all of you live very busy lives and have other occupations that demand your time, and that's true for both staff and board members and the rest of you that are present. So thank you for making that sacrifice of being here in person today. I truly, personally believe there's value in doing this on occasion. Although Zoom works and it works well, there's added advantage to meeting in person. So thank you for that. One housekeeping thing before we get started. The mics are here primarily to ensure quality live streaming. So even though you think you can hear everyone else in the room, please use the mic because we'll need it for the live stream. With that, I will turn it over to Melissa. Well, no, I guess I'll just, the August meeting minutes have been mailed out to you. You've all had a chance to read through them. Unless I hear objection, I will suggest that we adopt them by acclamation. Is there objection? If not, so ordered. Next item of business, early childhood block grant evaluation. I'll start with Melissa, but it will be a presentation from Lynn Schreferman.
So thank you. We will hear from Dr. Lynn Schreferman from Wichita State University. Lynn has carried out the Common Measures evaluation for our early childhood block grant for, Lynn, you'll have to tell us how many years because you predate me, 11 years. And we look forward to her annual report every year that speaks to the impact of this group of grants. So Lynn, I'll turn it over to you. Thank you.
Good morning. Thank you for allowing me to talk about data. It's my happiest thing in the world is talking about data, so I am so glad. I also want to thank the children and families of Kansas who have participated and been so generous with their time so that we can document the outcomes that are associated with these programs, and the grantees who work tirelessly to collect the data. And some of them have even learned to love the data, which makes my heart sing. So we're going to start with the descriptions of the grantees and the families. There are 26 grantees this year. That is an increase. We had 8 new grantees, but lost one. So it's a busy time for our team because we have 26 reports to complete. For each individual grantee. There were 8,067 children that were served. That's an increase of a little over 1,000 this year from last. 63 counties. The 2 new counties we had this year were Harvey and Johnson. And if anybody has any questions, please do not hesitate to stop me. I'm happy to answer questions. Free and reduced lunch was up a little bit at 70% this year. 51% were at risk in for developmental delays or in the monitoring area. That is an increase as well. 90% of the families had at least one of the risk factors that's identified by the cabinet, and there were 44% who had 3 or more risk factors, which is high. So I want to talk a little bit about outcomes. When we established the common measures, we worked really hard to make sure that we were using reliable, valid measures. And that's vitally important because we depend on this data. And so we were selecting measures that had to have a proven reliability, proven validity. They also had to have empirically based benchmarks so that we know how children and families are doing in comparison. And then we also need to have ways that we can make sure that everyone is applying those measures consistently. So I will kind of talk about that as we get to the individual measures. But I'd also like to talk about the economic importance of these outcomes. So many of you, I'm sure, are familiar with Heckman, James Heckman, the Nobel laureate, who has done a lot of research on the economic payoffs. So I want you to keep that kind of as a contextual thought as you think about this. Also, the Cleveland Fed has come out with a paper about the economic importance of early childhood programming and how it allows families to participate in the workforce, but also provides us with a better future workforce. So these families, 17% of them had increases in their observed positive parenting. 1% had an increase in parental stress, which we don't like to see. A 2% decrease in full-time care this year. 78% of our classrooms were observed to be high quality, which is a new high, and that makes me very happy to see because those high quality classrooms are very predictive of good long-term outcomes. 75% of the children, 0 to 3, were found to be on track by the end of the year in early communication. And when we get to that, dig into the details on that, you'll see there was a sizable increase. 59% of the 3-year-olds were on track in early literacy, and 70% were on track in language comprehension, and 68 overall in numeracy. So 68%. We tend as a state to do well in numeracy year after year.
Lynn,
So
just a quick,
I hear the sound coming from
sorry. Would you prefer to hold questions until the end or
No.
entertain them as they come?
I'm happy to answer questions now.
All right. Board? Yes.
Thank you, Mr. Chair. So my question is on the 59% of 3-year-olds on track for early literacy. How long have we been measuring that?
We are using a beta test for the 3-year-old literacy. We've been measuring 4-year-old literacy for 11 years. There are not very many measures of 3-year-old literacy. Quite some time ago, IES did grants where they wanted a continuity of measures, so the 0 to 3-year-old communication measure was part of that grant. The 4-year-old literacy and the 4-year-old numeracy were part of that grant. And then the DIBBLES, which some of you may have heard of in school-age children, was part of that grant. The same people who developed the MyIGDs are also developing a 3-year-old grant. She's had 3 IES grants that total like $14 million. And because I have had a working relationship with her, we are using the measure to help our grantees because I was going to get into this later, but one of the things that we found is once we started using this, even though the measure is in development and so it is changing a little bit, she's refining it, that actually children who were measured in that 3-year-old year were more likely to meet their developmental benchmarks in early literacy in their 4-year-old year. I don't know if it's because we're identifying them earlier or how strongly, because we don't know the rest of the population, whether it's associated with just getting services at 3. So, but it is an interesting piece of our data.
Well, I'm not sure if I understand how long it's being measured, but what about the on track for literacy for 4-year-olds? Is that a different slide?
Yes.
Okay.
This is just the overview.
Okay.
We'll go into the details in a minute.
Okay, great. When you get to that, I guess when we get to the 4-year-old, I'm interested in the trend and why that sounds like a really great number, but then why it falls so sharply by the time they're 3rd grade.
I can tell you why.
K-12. Well, I mean, I think there are a lot of interesting variables, but I find
Well, I think you're familiar with the discussion that's been going on around phonics and phonemic awareness.
Yes, I don't know why it was ever eliminated in the first place.
Well,
Yeah.
I can tell you, my background is I have a community clinical psychology background. And so when I first started doing this, I had worked in pre-Ks, but I had not done the educational. I did the social emotional. part. And so I spent a lot of time really reading about it. And when we first started visiting grantees, there are grantees that really pushed back when I said, you need to be hitting phonological awareness. And so last year was the first year that I didn't get pushback from someone saying, no, that's not appropriate. So unfortunately, it's...
Yeah, I will just go ahead and be quiet on that, but it is frustrating from our perspective that there was a gap of time where sight words were the thing, and I just think that's so sad that I was taught with phonics, and I know it's not exactly the same, but if we'd even stayed on that continuum, we'd have been better off.
Yes. I mean, and using pictures as cues and having a child say pony when the word says horse is not furthering their reading, for example. Okay, Lindsay. So the range of services offered by ECBG programs, and I will remind you that these services are selected by the community. Each community selects, and someone a few years ago said, a national researcher said, oh, that's a really Kansas model. And I really like that. So our grantees are doing what they look at the data and they decide that that is what their community needs. So these services are being applied based on the needs of the community. For caregivers, we have home visiting, case management, and parent education. They provide prenatal services in the form of home visits. For 0 to 3-year-olds, some of them get home visits. There's childcare. There is one program that provides Part C services. There's some classroom infrastructure, so a lot of coaching in classrooms, which I think is helping our quality go up because the quality is continuing to go up, and mental health services and developmental screenings and referrals. For the 3 to 5-year-olds, there's home visiting, pre-K, classroom infrastructure again, literacy activities, mental health and behavioral health, and developmental screening and referral. And all programs other than the Part C program screen children for development, because although that is not an outcome measure, we find it's very important to identify children early. These are the risk factors that have been identified on the RFP, and so this is what we track. Poverty is defined as the qualification for free or reduced lunch, single-parent families, children that are in the foster care system, children with teen parents, children whose parents have less than a high school education, children who have limited English proficiency, children whose development is lower than expected developmental progress, migrant families, families without stable housing, and children without health insurance. This slide represents the number of children by county as well as the individual grantees across the state. So you can see where the services are being provided. Some of those counties in the northwest upper quadrant of the state are actually can receive services, but they haven't had anybody who was willing to engage with the services. So those 3 counties that don't have any children in them. So 8,067 children. As I said, that's an increase of a little over 1,000. 7% of them were involved in foster care. 4% of them did not have health insurance. This has been a remarkably consistent measure across the state. We see variability from one location to the next, but it's typically 4% year after year. 22% of them did not have English as their first language, and 51% had an indicator of a developmental delay, which is an increase from last year. 6,971 families. This is an overview of the caregiver education because less than a high school education is a risk factor. You can see that we have a range of educational achievement in the families that are served.
Lynn, a quick question about the number served. You indicated a 1,000 child increase from a year ago. Mm-hmm. Is that due to better outreach and publicity of the services, or are more children falling into the risk categories?
Well, there are 8 new grantees, so some of that has to do with the new grantees and the services that they're providing. To be honest, I get hundreds of thousands of data points, so there are things I want to dig into that I haven't, because like I would be interested to see if some of the existing grantees are serving more, or if it's all the new grantees, because I am aware that many of the grantees are struggling right now to maintain staff. Because, for example, Christy and I were on the phone with a grantee in Western Kansas who the child care providers and the pre-Ks are losing employees to the prison, which seems like a really weird transition to me, but but they get benefits and higher pay, so. Yeah, working in the prison.
The clarification was that it's not as inmates, but it's as employees.
Yes. Yes, they're not, the big joke is the grantee there is losing one of his staff members. She's going to retire, and he keeps saying that she's going to open a prison program. So, 47% of these children had parents that were unmarried. 6% of them had teen parents, 1% migrant families, 5% without stable housing, again, 70% free and reduced lunch, and 26% where English was the second language in the home, and then 51% earned less than $40,000 a year. And as I said, that's an increase. It's actually an increase of 4% on the free and reduced lunch.
Senator Erickson?
There.
There.
Thank you. Just a quick question. Are those all unique, or
No.
I'm assuming that, we've got teen parents that are unmarried, so
Yes.
those percentages, there's a lot of duplicate
There, I believe.
individuals in each of those, correct?
Yes, I believe we looked at that, and I don't have it on a slide, so I'm going from memory, but there are about 260 different combinations. So that's why I can't really present that to you, because it would be so much information. It would either take 25 slides or just be too much. But the next slide will kind of give you a better overview of that.
Yes, Christy?
Thank you, Mr. Chair. So I do find it interesting that 47%, that's the number one risk factor. I see the 70%, but I see that 70% is probably attributable to the fact that it's a single individual trying to make their way. So that's why they don't have the income, the free and reduced lunch price. So if you have 2 working or 2 individuals, it's much easier. So I guess my point or my question really is, if we know the number one driving factor is single parenting, and obviously in America we've got a breakdown of the family, are we going to, as a new member, are there some of our programs that try to strengthen family and build family and keep families united and encourage that? Is that part of the educational backbone of some of our programs of really encouraging that the family be a unit?
I'll take this one. Yes.
Yes.
We have a blueprint for early childhood that has 3 pillars: healthy development, strong families, and early learning. So we, in our portfolio, invest in programs that help with parent education and different types of support services to help families cope and hopefully help strengthen them and mitigate for the kind of escalation and crisis that can lead to all kinds of reasons for breakup, whether it's a child having to be removed from the home into foster care, or the kinds of stressors that lead to difficulties with the relationships of the adults in the household, all of that. So you'll hear more about some of the work we do that is geared for the parenting generation as well as the early childhood programs, because we think it's all tied together.
Well, the quick follow-up is just to really, do we have, I know the numbers nationally, but do we have numbers for Kansas that helps us identify how many births occur in a single by just, the mother's the only one present?
I don't have that off the top of my
That's
head.
I would say
That's
that's a
a-
Bureau of Vital Statistics. I don't know
think
if you collect that.
for minorities, it may be as high as 70% in the nation. I don't know what it is in Kansas, but that would be also something that I would think the cabinet would want to understand, how many children begin life just with one parent.
Yes, Derek Florlog. I'm the Bureau Director for Family Health at KDHE. So I don't directly oversee vital statistics, nor do I have any authority to approve data requests, but I will take that back and certainly ask about that availability. And we do too within our Bureau. Amy Dean Kampmeyer's co-director with me and just kind of starting, but we do various parent leadership and trainings and webinars through Title V Maternal Child Health block grant as well. Kind of should at least work in collaboration with a lot of this. So, and we'd be happy to expand on that in a different meeting or separate outside of this as well. So,
All right, thank you, Derek. Question from John.
I think she was, if you want to go first. Thank you. I have a question about the unmarried description. So could that be unmarried but still living in the same household?
Yes.
Could that be married and then divorced? Could that? So,
Yes.
Okay. So it's a whole
Any
variety
parent
of things.
any primary caregiver that is not married
Okay.
is
Gotcha.
the way that it's currently defined.
Thank you.
Dr. Smith.
Yes, good morning.
Good morning.
Can you share how you're defining what family means? Because family can mean a lot of different things, and wanting to make sure that we're speaking and thinking the same language. Because just in my practice, we see families looking different types of ways, such as it could be grandparents, it could be aunts and uncles, it could be older siblings. So how are we defining families to make sure that we are all speaking the same language and having the same understanding?
Any unit of people that have a child and a primary caregiver is defined as a family in our data. So we do have some grandparents, some foster parents, I think, I haven't looked this year, but we typically occasionally have a sibling that's parenting a younger child. So there's a variety of different aunts and uncles.
Thank you.
Question with the Department of Corrections. So I'll let the Secretary know his recruitment efforts are working in some parts of the state. Sorry, it's at the cost of others. I noticed in the risk factors, you don't include families that are justice involved in the criminal justice system. Is that something that's just not collected, or is it a low number?
That is not something that the cabinet has defined as a risk factor in the RFP. We collect data, because the evaluation of these programs is one of the most rigorous in the state and even in the country. These programs are working really hard to collect data to reflect outcomes. So we collect only what we have to have because we're trying to make sure that the burden isn't too great for grantees. So I don't know, I'm sorry.
I would offer that if it is the will of the cabinet board to add that data point to the RFP and the data collection system, we certainly could make that happen. I think it would make sense to know more about that population.
I sense a consensus to collect that data. Am I correct? Monica?
Monica Meridian. I guess I don't have to say that. We're not on, you can see me. I think we maybe are getting ahead of ourselves. We're hearing a report on an evaluation process that's clearly articulated. And I think until we hear the whole report and, take it all in, this is a big evaluation process that has years of accountability and data behind it. So maybe if we just pause and hear the whole report, I think that's where I'd like to get to the end, and then see if there's any adaptations, because one simple motion by us causes an incredible ripple effect at the local level. I agree with you. I love that concept. But if maybe we could hear the whole report? Just a suggestion.
Fair enough. Thank you.
Well, and I would like to add, because of what you said, that I work with some national entities, universities, and things because of the measures. And I have been told that we are the first state in the nation to do this kind of comprehensive evaluation, collecting outcomes, not outputs, so not counts, of programs across the state. So keep in mind that this is 11 years of this is really impressive for grantees that they have done this. And I'm not taking credit at all. It's the grantees who have done this and the cabinet that's done this. Okay, so this is the big picture. Although the number of risk factors that a child has in their family and is exposed to isn't fate, the more risk factors a child is exposed to, the less likely they are to be ready for school. So this is an overview of the families and the number of risk factors. Now, it's a variety of different combinations in each group, but there were 10% of the families that were served that don't have a risk factor that's already existing on the cabinet. It may be that a grantee, because the grantees tell me all the time, oh, those kids have risk, you just aren't measuring that risk. So it may be that their parents are involved in the correction system, something like that. So 7% of the families have 5 or more risk
Question
factors.
from Senator Erickson.
Okay, I'm gonna get this down. There we go. Okay. Thank you. I'm sorry to interrupt, but just a quick question. The first sentence strikes me. The presence of risk does not inevitably determine. I understand that. Has there been any kind of data or examination of why some children can have multiple risk factors or be in families with multiple risk factors, and yet it doesn't determine? I mean, they do seem to excel versus those that, and then 10% have 0, but then, have we looked at what characteristics determine or maybe correlate or play into whether a child who comes from risk factors is able to overcome those versus those that haven't? I guess that's my question. Has there been anyone look at that?
Yes, there has been some research. They haven't exactly nailed it down because most things are caused by multiple things, unfortunately. Temperament does play a part in it. So if a child has a more easygoing temperament, the exposure to risk doesn't seem to have as much of a impact on there. So for example, Harvard does a lot of work around toxic stress, which is lots of risk in the family, and then you get to a point where you're just responding in this fight or flight mode all the time. And children with more easygoing temperaments are less likely to get into that mode. There can be other things like grandparents, there are other adults that are helping to care for the child, and as children get older, teachers can matter. So there's a lot of different factors. We don't actually look at it ourselves because that's not part of our charge here, but unfortunately, human beings are so complex that there's not a linear relationship between if this, then this for everyone.
If I may, Senator Erickson, I was really interested in this as well, thinking about, we see instances of resilience in kids that have had terrible childhood experiences. And I saw a presentation delivered by Gail Kozad at KCSL about kind of emerging research in what's called HOPE, Healthy Outcomes from Positive Experiences. And it's these mitigating circumstances like supportive adults in people's lives, or these other things that can mitigate those things, because we typically hear about adverse childhood experiences. And so I'm really excited to see more and more of that come out, that it is these kind of family level, community level, neighborhood, school level type interventions that aren't really interventions as much as just positive experiences that can be transformative. So I'll take the presentation that I was delivered. I'll get you a copy of it. Yeah.
Well, and I would say this is later in my presentation, but quality early childhood programs do serve as mitigating factors, and there's a lot of research to show that children with risk factors really their long-term outcomes are much better after being involved in a quality early childhood program.
Can I interrupt real quick as well? I just wanted to mention, we've been a part of some of those awesome presentations, John, and it's been interesting in my short time I'll still call it a short time, year and a half at KDHE, watching the presentations go from less focus on the adverse childhood to the positive childhood experiences because of the research that says that they're protective against those adverse. There's some cool stuff going on in the public health space as well that looks at the Childhood Opportunity Index. And so there's some research around that for kiddos to have access to like safe and healthy green spaces and parks and recreational opportunities and that sort of thing too. Because some of the things that they're exposed to in their communities, those things are very difficult to tackle, but by adding opportunity for them to experience positive situations, you know, baseball, softball, soccer, going to play on a playground, whatever it might be, those can actually be protective against some of the things they experience in the community or at home too. So I'm not the expert in that research, but again, we'd love to bring some of that to you all.
Well, and that's a
at the
great point
appropriate
about
time.
the community level resources as well. So the first area we're going to talk about is healthy development, which is the first pillar in the blueprint. So ECBG programs focus on healthy development through a variety of different areas, but they're really focusing on early life skills, so children's ability to attend, because you can't learn if you're not like sitting down paying attention, and this is something that's rapidly developing during this age span. Managing your emotions. If you cannot manage your emotions, then it can be problematic when it's time to go to school. Teachers frequently cite those factors as most important in kindergartners. Having positive interactions, interacting with your peers, interacting with your parents, interacting with your teachers. And focuses also on fewer behavioral issues, and that is also associated with better academic performance. So why are ECBG programs focusing on early life skills? Well, the development of those executive functions, which is the researchy word for a lot of those early life skills that have to do with attention and modulating your emotions, is very predictive, in fact, more predictive of fifth grade academics and assessment scores. So we look at early identification, which we're going to look at the ASQs, which is the Ages and Stages questionnaires, and that is the screener that we use to determine whether a child may have delays or actually needs to be referred. Early identification is associated with hitting future developmental milestones, and so we value that, and children, as I said earlier, all children except for those engaged in Part C services are screened, and that improves school readiness. There's also a lot of programs that are helping in, for example, classroom consultation or working with individual children who are having difficulties adjusting to environments that supports those executive functions, so that self-management, that being engaged in learning, and that social competency, as well as working memory, which has a great deal to do with early literacy. These are the counties that are served by the Healthy Development Programs. So, the reason that we have this goal is that early and frequent screening leads to early intervention and better outcomes, which lowers the cost for all of us. So that's why we really put an emphasis on making sure that children are screened, and KSDE is doing that as well. So it's nice. Kansas, I think, is becoming a much more saturated as far as screening, and that is only better for the long-term outcomes, because it's early identification really helps with early intervention, because if a child isn't identified, sometimes parents don't have the perception that their child has delays because they think that is, their perceptions can be they can be skewed by their experiences, and so by screening, we're comparing them to a benchmark and looking to see if they're meeting that benchmark. So these programs are using the screenings to build relationships with parents and help parents understand what is developmentally appropriate and help them so that they have appropriate expectations. It's also a way to address concerns if parents or teachers have concerns to determine whether the child might have delays. There are activities that they can engage in, both for parents or teachers, to help improve in those areas, and they can make referrals. So this is the data from the Ages and Stages questionnaires. As is typical, we have the highest risk in fine motor. We do have some grantees that have moved up in fine motor, so I'm hoping that all my squawking about fine motor is helping them to focus, but children spend a lot of time on screens, and that is showing detriments nationally in fine motor and actually internationally. All of the areas showed small increases from last year. The other healthy development measure that we use is called the DECA or the Devereaux. It has age-specific screeners, or not screeners, measures, and it measures a child's social emotional development. It is a strengths-based measure, and it is reported by the teacher or the parent. And understanding that their ability to regulate their emotions and build relationships and attend is really important at this age, and many of our programs are working on these things, so this is the measure that looks at change associated with this. So the DECA has 3 subcategories: attachment and relationships, because that's an important aspect of child development, self-regulation, and taking initiative. So here you can see the development and change. So at the beginning, at the first time that they were measured, mostly in the fall, but not all these programs function on the same calendar, so that's why we use time 1 and time 2. We started with 78% of the children being on track, and it moved up to 87%. So these programs, that 9% increase, is associated with programs where there's someone coaching a teacher. So if there's a child that's disruptive in a classroom or not functioning well in the classroom, the coaches work initially with the teacher because they're working on the context. Then sometimes if there's additional help, they might work with small groups, or they might even do some individual work with the child. Next, what we did was take all of the children who were at risk and look at the change for them, because this is the children that it's most important that we see improvement. And 58% of those children moved above the benchmark following the services. So this is an impressive increase in those skills for those children, which makes them much more likely to succeed once they go to kindergarten. Because as I said, there are studies where they've interviewed kindergarten teachers, and kindergarten teachers really don't seem to care a whole lot about whether a child can count or identify letters or anything. They want to know, can they get along with their peers? Can they follow directions? Can they moderate their emotions long enough to wait for a minute when it's not their turn? And so this is a good predictor that those children are going to be more likely to be ready. Next, we have strong families, which is the second pillar in the blueprint. And ECBG is fulfilling that strong families vision in the blueprint with positive parenting, so promoting positive parenting. Reducing parent stress is one of the goals. Improving parent skills and their ability to parent. And those are 2 kind of dependent factors, because those of you who are parents probably know you don't do your best parenting when you're really stressed out, because you can't stop and think because you're too busy stressing. So it's important to have both components. These programs also work to connect families with resources and improve child outcomes. Evidence-based parent programs have been found to decrease disruptive behavior by children, as well as change parents' perceptions of their child and their interactions with their child. And one of the most interesting things that I find, because when I was in graduate school, I did a lot of research on parenting interventions, is that these interventions are actually having long-term effects after they stop intervening. So basically, these programs, these home visiting and parent education programs, are teaching parents new ways to interact with their child, building positive relationships, because those positive relationships are core to those skills and those relationships. So by having those positive relationships, you're able to effectively discipline your child. So one of my mentors always said that relationships are like a bank account, and that you have to put it in. So you have to have those positive interactions, and when you have those positive interactions, you're banking. And so then when your child is misbehaving and you need to set a limit, you've got money in the bank to take out. And I think that's a great metaphor, and I use it frequently because parents can understand that. And it helps them to understand, oh yeah, I've got to do these, and I use it with teachers, but it's really true of all relationships. You've got to have that positive to build those interactions so that when there is something negative, you have something to draw on.
Okay, we have a question.
Yes, thank you. Real quick, on your overview, I believe it was something like 17 or 18% of positive parenting increase, but a 1% increase in parental stress. So can you kind of explain that in light of this information?
Can we hold that thought until I get through the data? Sure. I'm sorry. I probably should have told you. That's really, I tend to do an overview at the beginning to let you know what's coming. So we're going to dig a little deeper into that data. And then I think that's a great conversation. No, I love all the questions because I love the data. So, so anyway, these parenting programs do tend to have long-term effects after the program ends.
Another question, John?
And I give you permission to say, wait. I don't remember. I don't have off the top of my head all the names and types of programs, but I'd be interested to know the kind of dosage of positive parenting, coaching, whatever. Is this at pickup and drop off? Is this specifically home visiting? Is this an evening class?
Primarily home visiting, parent education, or case management.
Okay.
And the dosage or the intensity. I was told not to call it dosage because that's too medical. Is really variable, so it can meet the needs of the family. So we have some programs that are a home visiting program where they visit once a month. We have others that are much more intensive, so it's a whole continuum in order to meet those needs. The same with parent education. So we have some that are evidence-based group parent education programs, but we also have some that are evidence-based one-on-one parent education programs that are much more intensive.
Thank you.
Sure. So these home visits, can you go back for one more minute? Home visiting programs have been shown to improve positive parenting skills, that early development and health for children, so helping parents understand development and screen development, and also sometimes screen. And home visiting can take a variety of different forms. They focus on different things, so it's a very, very varied. It is a varied group of programs that address different things depending on sometimes the needs of the family or the specific program. And it also impacts school readiness and behavioral programs. The parent education programs tend to decrease parental stress, decrease disruptive behavior, and improve the parent's perception of parenting and their child. So the Strong Families programs are home visiting, parent education, case management, and mental and behavioral health. And these families meet a variety of needs and a variety of different intensities. And they're basically selected by the needs of the community, so not dictated by anyone outside the community. And they're positively impacting communication, social emotional skills, and the brain development in children. And as I go through this data, I want to remind you that each year is a new cohort. This is not a longitudinal study, so we don't follow children over time. My evaluation is for that 1 year of funding, and that is also, you'll see the historical data, but each cohort comes in with a variety of different skills, strengths, and weaknesses, so it changes from year to year. Okay. So the majority, slightly, of families, a little higher, are participating in the parent education programs. Then almost that many families are participating in home visiting. There's about half that are participating in mental and behavioral health, and then a smaller group that is getting case management. And again, these are based on the needs of the community and the families. And here's another map, because I always like visuals to know where these things are going on. So this shows you where the Strong Families programs are taking place.
Just to clarify on that map, it's the counties in blue, and it's not to say that other sources of funding aren't funding this kind of program. The blue counties show you what our early childhood block grantees, what their reach is. So which ones are providing these services in those counties.
So we're going to look at the Strong Families outcomes now and how those relate to positive parenting. And the first measure is called the KIPS. It's the Keys to Interactive Parenting. It's an observational measure, play-based. I like play-based measures because they're appropriate for children in this age range. So all the parent and child are asked to do is play, and then trained observers who have gone through training, been certified, they recertify every year, are the observers, and they rate these parents and children. And what they're rating them on is sensitivity, support, involvement, adaptability, engagement, limit setting, encouragement, and promoting exploration. And one of the reasons I really like this measure is because I'm able to show grantees the change that they have in each area. And I can tell you, as I said, programs focus on different things. So there is a program that is doing intensive home visiting, so they're collecting the KIPS, and they are really literacy focused. They're really focusing on early literacy. So I presented the grantee with her data, and the limit setting change was almost nothing. All the other areas had changed, but not that. And the grantee looked at it and she said, limit setting. And I said, I think that's because your program doesn't really direct it. And she said, well, I can fix that. And then the next year, they had as much change in limit setting as they did in all their other areas, because she felt like limit setting was important. And limit setting is. The research shows that that is a very predictive area for children's long-term outcomes. So here's an overview of the change. And this goes along with what I was talking about earlier. So those different areas are collapsed into 3 overall areas. And the first one, building relationships, it makes me really happy to see that that is the highest area, because as I said, those relationships matter. And so it's vital that parents are building these positive relationships so that they can set limits. But we are on average, we're well above the benchmark for all of these, promoting learning, supporting confidence, and the overall average. And here you can see that 17% increase in children who are considered, or parents that are considered to be above the benchmark in positive parenting. This is a sizable increase. And here you can see historically, it appears that we are serving, even if the risk indicators are only slightly higher, this indicates we're serving some very risky parents, because this is the lowest in 5 years as far as the parents that are on track initially.
Well, and pointing out, it's the starting point that clearly
60% is much lower than it's been in 5 years. The next area is parental stress, and this is important because, as I said earlier, if you are stressed as a parent, you are less likely to apply your best parenting skills because your mind is going in other places. John's frowning. John's a great parent when he's stressed.
That's my natural guess.
Sorry, I was just like, does he disagree? Yes, our children love it when we're stressed, don't they? Parental stress impacts positive parenting. It also, there's an interactive response, so children tend to be more stressed when their parents are stressed. And so that reciprocal interaction can make the whole household stressed out. And it also impacts their caregiving. So this measure looks at parental distress, parent-child dysfunctional interactions, and their perception of how difficult their child is, as well as their overall stress level. And here you can see there was a little bit of movement, but it was in the wrong direction, which is an indication that families are more stressed. 1% is not large. Last year we saw a 3% decrease, but it's an indication that families are struggling. And here you can see the stress level started even higher than they ended last year. They're even higher than they started, actually. So generally, again, we're seeing more risk across the board in where families are starting. So as I was working on this, I was thinking about it and seeing a lot of information about what they call COVID babies, which these are the COVID babies. And I was really curious because there are universities in the United States and in England that are finding decreases in language and speech abilities in children that were born during COVID, decreases in cognitive skills. And what's happened is researchers that are doing longitudinal research are just taking advantage of the fact that they were already doing longitudinal research, so we have some pretty good data on that. But also, they're finding in interviews with teachers, teachers are having to spend a lot more time on just adapting, helping children adapt to the classroom, focus. And I can tell you from my own personal experience, as I said, I wasn't in education, so when I first started doing this, and I continue to do this, I volunteer in a pre-K classroom. And when I'm in the pre-K classroom, up until COVID, I would have to be there 3-4 times before anybody climbed on my lap, because they didn't know who I was and they needed to know that I was a safe person. And since COVID, I walk in that classroom the first day of the school year, they don't know me, and I have a child on my lap the minute I sit down. And I think that's kind of just a anecdotal way of me saying that children are just needing a lot more in these classrooms, and the teachers are finding that as well. So what we did was I had 2 of my colleagues at Wichita State because we wanted this to be an anonymous survey that wasn't associated, so that they could be forthcoming. So it wasn't associated with me, and it wasn't associated with the cabinet, other than that they're getting funding from the cabinet, and I gave them the names. So 24 of the grantees replied to this anonymous survey about what factors they thought were impacting their families, because after reading about how this is impacting children so much, I wanted to see what the grantees were seeing in their local communities. So there were 22 items that were divided between family factors that included economic and social stressors, program factors like staffing and funding, and societal factors. And the idea is really to provide a context for the data, and I thought because a lot of this has to do with families that it was important to talk to you about this now. So each of these 22 items was rated from not at all important to extremely important. The top factors that were identified by these 24 grantees, the top one was family factors and social stressors. So increased behavioral health concerns, which I think we've all heard a lot about that going on right now, mental health and substance abuse problems. And the average rating on that was 7.8. Then there was program factors, difficulty maintaining pay for staff, those corrections people recruiting too well was the next factor. Then we had some more social stressors for families, and that included increased screen time for children and social media and games. And then economic stressors were the fourth factor that was strongly cited. Now we're going to look at early learning and the outcomes associated with the early learning programs. So ECBG programs are addressing this quality care and education pillar in the blueprint by focusing on quality. So a lot of the coaching that goes on in classrooms helps teachers to become better teachers. So we're really focusing on high quality because the research in early childhood says that quality really matters. And so we want to make sure that these environments that we are providing for children are high quality. It also focuses on positive interactions because the research shows that those interactions, again, it's all down to relationship. I think that I should have just said, we're going to talk about relationship today. That those relationships between teachers and their students are very predictive of long-term outcomes, much more predictive than teacher education, ratios, any of that. So it's really those relationships. Now, ratios can impact relationships because if you don't have time, but they also impact, they also impact future academics, and we're focusing on phonemic awareness because that's critical. So most of you are probably familiar with James Heckman's research and the 13% return on investment, so that's one of the reasons that we're focusing on it. And children in high quality early learning environments are better off, and he's doing second generational research, and they're finding positive effects for the children of children who are engaged in these high quality programs. So we find significantly better employment, education, and social behaviors, health, and family factors in children that were in high-quality early childhood programs. And in addition, he's found that lower school suspensions and higher high school completion in the second generation of these children, as well as higher levels of full-time employment and lower crime. And I will say that there's a lot of different outcomes related to some of these programs, but what the underlying factor that we're finding is that kind of improvement in those kind of social executive function skills that carry children through their life better. So they may not have always significantly better outcomes in certain areas, but other areas in these long-term factors are what really are impacted and have a lot of staying power.
We have a question.
Quick question. Are we talking about all children? Are we talking about children with these risk factors?
Heckman's research is related to primarily, he's done a lot of research, but the long-term second generation were children at risk.
Thank you.
So this is a breakdown of the early learning programs and the children served. So the smallest number of children served were in that Part C program. And then we have social, emotional, classroom, and family consultation. Then we have 0 to 3 care and education and pre-K. And these are the counties that were served by these programs. I did want to point out we had a 2% decrease in the amount of full-time care in the state this year. We had been increasing kind of steadily, and now it went down last year. So the first measure, outcome measure, is the class. Oh, sorry. I start walking away from the mic and then I think, nope, get back there. The class is an observational measure that is gauged for the age range. There is a very intensive training process, and you have to certify, and you have to certify every year. You watch videos, you rate them. If you don't recertify, then Cassie, a member of my team, retrains you or says to your grantee, some people are just not cut out for this. And it has nothing to do with like how smart you are. It just, some people are great class observers and some people aren't. So they go through that process, and on top of that, we do reliability checks with grantees across the state. So we're making sure that they are using this measure with they're not drifting, they're not changing the definitions, and we've done intensive work in order to do that. Those interactions in those classrooms are super important. For example, Harvard has found those serve and return interactions, kind of bouncing a ball back and forth conversationally, are very predictive of good long-term outcomes for children. And those observations that a classroom is meeting high quality helps teachers to provide better environments in their classroom. And again, goes back to relationship. This is data that is actually from Kansas, from our data. A few years ago, we looked at the class observations and then looked at the growth in phonological awareness for children. And what we found is for the children that are most at risk, their growth was strongest if they had a teacher that was really strong in those relationship building skills at the beginning of the year. So basically, that tells me you have to build a relationship with this child before you try and do rhyming, alliteration, and sound identification, because otherwise you're not going to get the traction you need in order to see improvement. And you can see that we have the highest level of classrooms rated as high quality by the end of the year this year that we ever had. We had a 10% increase, so our year-end percentages have been steadily and slowly increasing. Next, we have early communication. This is the measure, the youngest measure that I was talking about earlier. This is called the IGDs. The acronyms for these academic measures can get a little much. We have the IGDs, we have the H3 IGDs, and we have the MyIGDs. This is a play-based measure again, because for 0 to 3-year-olds, play-based measures are the most appropriate. So basically, the assessor sits down with the child and has a conversation about a toy, and an observer rates. And what they're looking at is gestures, vocalizations, single words, and multi-words. And this is benchmarked for children in this age range. It was actually developed at Juniper Gardens. So I like it that we're using a Kansas measure. And those early communication skills can be very important and predictive. That's okay. So here you can see the increase over time. So there was an 18% increase in early communication, and 75% of those 0 to 3-year-olds were on track. And I think this is particularly impressive because a large proportion of these children were in that Part C program. So this is the measure they're using in the Part C program. And here you can see within the context of the last 5 years. So the last 2 years, we've really made strong gains. The next measure we're going to talk about is the MyIGDs. And this is the 4-year-old early literacy measure. It is found to be reliable and valid, and actually the MyIGDs literacy is now on the iPad, which makes it even more precise. It's wonderful because an iPad can do things that I can't possibly do. So when picture naming was given by a human without the iPad, you had 10 pictures and they named the 10 pictures, or they didn't. With the iPad, that picture naming can have almost 200 different pictures in the pool, and so if the child doesn't get the first one, it can go to an easier one. If they get the first one, it can go, so we get a much more precise score, and there's not as much of a floor and ceiling effect. So language comprehension is made up of picture naming and which one doesn't belong. I'm not exactly sure why, but for all 11 years, we have done outstanding in which one doesn't belong. Kansas, this is supposed to be nationally the most difficult subtest. In Kansas, it's not. And I always joke that it's because we're common sense Kansans, so we can just, but I don't know. It just, every year, it is across the state. So it's not like it's one group. It is just, I find it fascinating. Okay, Lindsay. So here you can see the change, the increase in the percent of students that were on track in language comprehension. So we had a 21% increase in language comprehension. These are skills that in early literacy that tend to come online early. So these are the kind of earlier skills developing. So I like to see that up at 70%. And then here you can see the comparison. Again, we started lower than we have in past years. Next, we have the other component of the MyIGDs, which is phonological awareness. And these are the skills that come on later. In fact, the alliteration subtest is not even given until the winter because it is not appropriate for the fall. So that subtest has rhyming, alliteration, and sound identification. This is the ability to detect and identify, manipulate individual sounds in spoken language. And strong phonological awareness in pre-K has been associated with third grade, stronger third grade reading on track in third grade. So it's vital that they address this. We're struggling. Like I said, I feel like I'm preaching about phonological awareness, and I've gotten a lot of pushback, and I'm starting to win them over because it's getting more national attention, and I'm hoping, since the legislature talked about it last year, and because it is getting more national attention, that I won't get any pushback this year is my strongest hope, because we need to really focus on this. So we had a 6% increase overall, but children went down in the winter. Now the test does become more difficult with each season, so it progresses with their age. And we ended up with 41% of the children on track at the end of the year. Here you can see that we started very low with 35, went down to 33, even lower, and then got to 41. This is also a much more difficult area to teach. I see some skilled teachers doing rhyming, like in the hall. Rhyming's kind of a little easier, and I think they could probably, alliteration has been one of our downfalls, and I'm going to suggest that they start doing alliteration in the hall. But you can't teach a sound identification lesson in the hall. That is something that is very planful because you're working on those phonemes, and it's just something that the teacher needs to be prepared for, and you can't have distractions. Here you can see those changes overall, and so what I've got here is the children that are, the red dots are the children that are either only on track in one area or they're not on track in any. The lighter green is the children that are on track in 3 to 4, and the darker is the children that are on track in 5. So you can see the progression, so we are improving overall in literacy, but we are still have some children that need more help. Next, we have numeracy. We tend to do well in numeracy year after year. This is one area where we tend to shine, and this is the MyIGDs numeracy. Renaissance has promised me an iPad version for 5 years now, and every year in the spring I say, hey, is it going to be ready for fall? And they say, no, not this year. So I don't know when they'll have it, but My hope is, because then it becomes adaptable in like picture naming and the other literacy tests. So this has oral counting, number naming, quantity comparison, and one-to-one correspondence counting. I have a couple examples there to show you. And here you can see the change over the years. So we started at 55% of children on track and ended at 68% of children on track. So there was a 13% increase. And here you can see compared to the last 5 years. Again, this is just showing the growth in that development from fall to spring. You'll notice that there's less red. Numeracy is a little different because they benchmarked it by age in months rather than by seasons. So the literacy is benchmarked by season. So fall, winter, spring. Numeracy is based on the child's age. And it makes it much more complicated, but I would say developmentally that may be the most appropriate way. I don't have the clout to get anybody to change their benchmarking, but there's some fascinating research that's showing that development. So children they took a bunch of insurance records and looked at children who turned 5 in the 3 months prior to school starting and the children who turned 5 in the 3 months. They are the ones that turned 6 in the 3 months after school started. And the children in the group that were the youngest had a 35% increase in being diagnosed with ADHD. So what we're pathologizing is probably in many cases just development or lack thereof. And so that makes me think in some ways it makes it much more complicated when you have benchmarks.
And we have a question.
Yeah, you're on.
Thank you. All right, I'm waiting for this button to light up. Okay, thank you. Can you go back to the last slide real quick?
Sure.
The last slide, so that's over 3, okay, no, it wasn't that one. It wasn't that last slide. But there was one where you measured from 13% to 68% of children on track for early numeracy. Yes, that one, 55.
That's a 13% increase.
15%, right, 13% increase over 3 years or
No,
in 1 year?
fall, winter, and spring.
1 year. Now, do we have another slide? This comes back to my previous question that shows year to year.
Yeah, that's
improvement.
this one. So
That
these are
one.
the last 5 years now during COVID, we didn't have enough spring measures, so that first year, so.
Okay, so it looks like we're so 68% on track for 2024, but 73% on track. Help me read that.
Different cohort.
Different
of
cohorts,
children. Higher level of risk, so lower starting point in the 23-24 year. The incoming class that participated in this evaluation started at a lower point, had 13% growth over the course of the year. And yeah, so that's different kids each year.
Okay, so if we just look at the spring, then we see a 73, a 75% on track. So I guess my question to you, and it just continues to be something that I'm pondering, and I don't know that you'll have an answer, and maybe it'll be something that will be revealed at another time or another point in our discussion. But if we can have 75%, if the answer is early intervention, and we're having some of the most at-risk students that are being captured in this number, 75% are on track, but by the time they're in 3rd grade or by the time they graduate, we might have some of our most at-risk kids, only 10% being proficient, meaning that they're in the top 50% of students testing mathematically. And the last time they'd be tested would probably be the 10th grade. So I guess I'm really struggling with where is the cliff hitting when they get into school.
Amanda is probably a better person to answer that because I don't have that data.
Is shocking. I know we're looking at different measurements, so it's not necessarily apples to apples, but we know from those that are graduating and the employers, our kids are less and less prepared. We know the Kansas Board of Regents testifies to us annually. We are lowering our standards at our colleges to adapt to our students that are less and less prepared. So I guess we're doing this, and when are we going to anticipate it catching up so that we can see the results in our schools? Because we are seeing, since 2015, before COVID, we're seeing kids do worse.
Well, and I'm not laying blame on the Department of Education, but I would say that there's a whole lot of intervening years and factors, life, schools, everything in between those times. They cannot, if they're not school ready, they're much less likely to achieve those outcomes, but there's still a lot going on after they leave these programs.
Representative Williams, I think that one piece that is currently missing in our infrastructure in Kansas is our ability to connect data so that we're able to see which children participate in this program or other grant-funded programs operated by other agencies, and then be able to connect those same children to understand, okay, for this cohort of kids, does that trend hold true, or do these children do better than our overall cohort of Kansas students? I will say that one study that you might take a look at, if you're not familiar, is from one of our grantees, the Opportunity Project, or our grantees, one of the Children's Cabinet's grantees, the Opportunity Project, or TOP in Wichita, has actually been able to connect their data or follow children longitudinally so that they're able to see, all right, we've got a cohort of children who are receiving a really high quality early childhood experience, and then follow them to be able to see, yes, those children do in fact do better as they are progressing through the school years. And now we've actually had children who were top graduates who are now graduated from high school and in college. So we are able to see that for some children, these kinds of high quality experiences in Kansas can lead to improved outcomes later on. Our challenge is that this is a fairly small subset of our overall Kansas population. The Early Childhood Block Grant is an incredible program. It's not one that's available in every community. And so when we look at this data, one wondering that I would have, I would suspect that these children perhaps do better later on than our overall cohort of Kansas students. Does that make sense?
Yes.
And I will say that we are, there is exciting progress ahead in terms of being able to upgrade some of our data systems so that we are able to better link data and better understand, okay, when we have interventions or when we have programs that happen in other parts of our early childhood system, then what happens to those children later on?
May I, Mr. Chair? I think that's great. I think anything that we can do to benefit our kids and make sure that they have a good quality education so they can get on the right footing. I do think there are other things that are not part of this puzzle here that are equally as important. And I am intrigued from the KDHE perspective on some of the questions one question that I mentioned, but Renee's heard me say this before, but I keep coming back to what President Obama said in 2008, and he said that fatherlessness is the killer of what's happening in America. And he said your kids are if they don't have a father in the home, they are 5 times more likely not to graduate from high school, 5 times more likely to be in poverty, 9 times more likely to not graduate high school, and 20 times more likely to be in prison. And so I think about all of these things that are impacting our children and their potential success, and education is absolutely one of those things we want to get a hold of for that 13% improved outcomes. But I do think that fatherlessness one may be a bigger piece in the puzzle. And I wonder if KDHE at some point will take a real hard look at that, because I do think that's a key area for families in Kansas to have that when possible.
Here you can, here you can see the change in numeracy scores. And again, the red dots are children that are not on track in any area. And then the light green is some areas, and the dark green is all of the subtests. So all 4. And you can see the improvement over time. There's a few stuck down at the bottom, but most children improved, and there's very little red on there. And that's the other thing I would say is that a lot of what I do is oversimplified because there is so much data that I'd be standing here talking to you for days if I showed you, even some of the stuff I do for grantees, because it's more complex. But that percent on track does not show you the children that, can you go back to that for a second? The children that moved from red to the light green, so they're on track in some of the subtests, just not all of the subtests. And it's the same with the literacy, that they're making improvement, but maybe not meeting that criterion all four. Bless you. So, in conclusion, there was an increase in the number of children and families served this year. 90% of them had one risk factor. 51% made less than $40,000 a year. 51% were at risk or had an established developmental delay. And there was a 9% increase in children on the Devereaux on track in social skills or early life skills. As far as strong families, parents indicated that they had an increase in that parental stress. There was also a large increase in positive parenting following those parent education programs. As far as early learning, 53% of the children served in pre-K or 0 to 3 were in full-time care. Classroom quality was the highest it's been in 5 years, so that bodes well for the future, because as long as we can maintain those teachers and not send them to corrections, then they will continue to provide quality care. 75% of the 0 to 3-year-olds were on track in early communication. 41% of the pre-K children were on track in phonological awareness, and 68 were on track in numeracy. And many of the children that were not on track moved up and were closer to meeting that criterion and being school ready. That's all I have, other than a whole bunch of reference slides, which I don't think you want me to read you the references, but does anyone have any?
Your chair, I have.
Yes, Leetta?
Thank you. Thank you, Dr. Schipperman. Great
You're
report.
welcome.
Couple of questions. Early life skills, you mentioned the classroom management, the context. So that's a common complaint from our teachers in the classroom, is classroom behaviors, especially since COVID. The kids just don't know how to regulate their behaviors. And so when you talk about context, can you talk a little bit about what that is, especially the early childhood classroom context?
Well, it's multi-layered. Context can be the teacher, it can be the school, it can be the curriculum, it can be the coaching, it can be the community at large. So there's a whole lot of different factors that go into that, but it's also the context of these children coming out of being born during a pandemic and not getting those experiences that many children would have had in their lives, that exposure to other people. You know, many of these children went years with very little exposure to anyone other than their immediate family. And so there's a whole lot of different contextual factors. High quality classrooms is a big contextual factor. I can tell you when we do more detailed analyses, it depends on the children. So children who start out the school year on track are doing better in the literacy areas. They're more impacted by their whole school context. So if they're using a good curriculum, if they have good coaching, if they have a good kind of educational momentum in that school and literacy kind of context that encourages that literacy, then those children that start out doing pretty well are more likely to grow more. Where when it comes to the children that are higher risk, they're more likely to grow when they have a really skilled teacher and that classroom is more skilled. So there's a clear difference we're seeing in these more detailed analyses. So that's a kind of multi-layered contextual piece that we are trying to help, we help schools and grantees. So sometimes, like, for example, one of our grantees is, we're going to have their meeting and we'll go over their data, but I have classroom level data, but the teachers can't come to that meeting. And so I have scheduled, after I get their fall data, we're going to do their fall data coaching, and we're going to talk about last year's data and what we found out about their classroom. And it's nice because it also shows them how well they're doing with children who start the whole range from low to high. And that can be really helpful because they don't necessarily always, they see the individual children in their scores, but they don't see that big picture. And so that can be helpful. Because I also think it's tragic if they're not addressing the needs of the children who are starting out doing well, because who knows, that kid might cure cancer or whatever, you know. And the other thing is, if we're not challenging children who are starting high, then they're more likely to have behavior problems in the classroom. So there's multiple reasons that we do that, and we're trying to help with those contextual factors. It's hard, though, because every community is different and every school is different, and so trying to help them, all I can do is show them the data and have conversations where we talk about, you know, oh, this classroom really didn't have a lot of growth, but you have this classroom over there that has spectacular growth in phonological awareness. Do we know what this it's different? Is this classroom, boys don't do as well in that area, so is this classroom really heavily loaded with boys? Or is it that this teacher has been teaching a lot longer and maybe she can mentor this teacher? There's a variety of different things that we help them look at, but we only have one piece of the puzzle and they have many other pieces.
Thank you. Do you mind if I add two other comments? The follow-up questions on the stressors for the positive parenting, brilliant. Thank you for that, drilling deeper, because parents are stressed out. And so it really helped. My guess would have been economic drivers would have been top, and it wasn't. So that was really nice to see that. And then your comments on quality care in education, it's all about relationships.
Yeah.
It is. And I mean, that's a great life lesson. I love the analogy about relationships are like a bank account. I wrote it down. I'm going to use that. And then all of your data on the trends, I just found myself yearning to see the data before the year of COVID. And I know, I mean, we're now, can you believe it, you know, almost 5 years out, you know. But when you glimpse at the years prior to the COVID year, how did they look? Were the kids coming in higher early on?
It's a lot of years for me to remember.
know.
I will tell you that I can say that phonological awareness, we kind of started getting momentum built, and then it kind of just slid backwards during COVID.
Lynn, I mean, we have the data.
Yeah, we have the
with a little time to compile, we could probably give a broader snapshot of that year over year.
I hate to create more work, but I mean, what we saw was basically like COVID forward. It would kind of be nice, just, you know, because I'm like the long timer, you know, on the cabinet. It would be nice to see where we were trending prior to being slammed with the pandemic. And your work is so amazing. I mean,
I think we show you 5 years of data at a time, but you can go back to those years and pull together updated.
I'd be happy to do that.
thank you.
I'm never happier than playing with data, so most people don't feel that way about data, but I do.
You're awesome. And do we get a copy of this great report? And do we?
Sorry. Yes, the slides get posted today
Okay.
on our website. We can email them to the board members and our ex officios included, so that you have it for quick reference.
Thank you.
Well, and I'll be interested to see, Amanda, how these children track through the school system. But even the children you have now were impacted, so.
Question down here. 2 questions.
Oh. That's because once I got it on, I left it on. Thank you, Mr. Chair. And Dr. Felter's question kind of sparked a question I had. It reminded me on the 4 factors, I think number 1 was like mental health and substance abuse.
That was the 3rd. Can you go back to that slide? Let me.
It was the new study you had your colleagues kind of do with the 20.
Yeah, the survey.
Yes. Yeah, and in, yeah, yeah. And I think that's what Dr. Felter was referring to, and that
35.
reminded me that. So are those, the four things, mutually exclusive? Because in my mind, when you've got a family in economic distress that leads to stress, that can increase mental health issues and all of
Well,
those things. So
one more.
those four,
There,
yeah, I would say are probably not mutually exclusive. Would that be a fair statement? And do we know how those?
we don't, because this
Interact.
is survey
Thank you.
data. We're asking the grantees, so we didn't ask them about overlap. This was just what factors they perceived that were impacting their children and families. But I would agree that I'm sure there's probably overlap.
Thanks.
I know, I keep sticking on mine.
This is a fantastic presentation. I've been on the board for a
you.
while, and I know I've seen the updates. For some reason, this one seems to hit harder, or I'm in a place to soak it in more. So I appreciate it.
It's a lot of
Yeah.
data, and I really struggle with trying to make it understandable, but not go into so much detail that we're here for days.
Yeah. So we know that quality childcare happens in a variety of settings. We have that's what makes Kansas great is our mixed delivery model, and so family childcare is one of those settings that can be very high quality and likely would see some of these positive outcomes that we see. But just to be clear, the ECBG is only going to center-based
Nope.
child. It's not.
We have a few grantees that are working with family care as well.
Okay, great. That's really great to know. Then this may be a Derek question here, but what percentage of licensed providers are represented in the ECBG? It's got to be very tiny.
It's not something we track.
Very tiny, right? Okay.
And I would just say that overall, our Live Well Northwest Kansas is a cabinet grantee, and they have reach across multiple counties with partner programs. And I think many, not most, but we have Russell Child Development Center in Southwest Kansas. We have
Family Resource Center.
Yeah, so we have some Family Conservancy as well, grantees that are our recipients. So they're the ones we are doing the interaction with. They then go out and partner in the community with other types of programs. So that's where we will have one of our grantees working with the family child care providers in their communities, et cetera, and other types of services. So
Okay.
we ask for a lot of data input from them. I think this is a discussion we need to have, is whether there's a need, a will, a desire to add to any of the risk factors, demographic data, and what's realistic for us to incorporate into the RFP. We also probably can get at answers to some of those really interesting questions as we build the longitudinal data system work that's happening and the early childhood data trust work that's happening. There are other ways besides the ECBG grant evaluation that we might get at combinations of data and insight that will help us better understand the interaction between these high quality early learning programs and services and outcomes over the life course.
Just one, as we think about the question of the work that goes into being able to complete the evaluations and the work of grantees. I feel like we've in the past talked about the cost to comply with the evaluation requirements. Do we have that, or have we asked that, or?
And Lynn, if you can probably speak with more detail than I can. To participate in our evaluation, the tools are wrapped into, we're not asking them to pay outside of their grant budget. I don't know I know we provide training.
We provide training for those that require training, other than the KIPS, because it's online and it's just much easier for them to do that on their own. But they put it in their budget. But like we don't have cost in man hours and things, but I will also tell you that we have grantees that value this data so much that even with the beta version of the H3, they're, can I do extra kids? Yes, you can do extra kids. Can we do KIPS on these families even though it's not required? Because we have somebody that thinks this data is really valuable. So I think there are many grantees that are seeing that this is really useful information and incorporating it. And to be very honest, when we first started this, and I didn't cover that this time, I try and do it every other time, but we visited all the grantees before we determined the measures. I found out what they were measuring. I found out the details of their programs. And then what we did was try and find the measures that not only would satisfy the cabinet and the need for evaluation, but also measures that could be useful for the grantees in improving their programs. And that's why Christy and I are going to be on the road for 2 months, visiting grantees and explaining their data. And then I do it frequently throughout the year. One of the people on my team and I do data coaching calls. So we try to really help them so that it's useful, so it's not just, oh, I have to do this for the cabinet.
Sure. Thank you.
Question from Monica.
So I know I say this every stinking year, but I'm just going to keep saying it because it's a true fact. This evaluation design is the most comprehensive that I've seen in any childhood program in Kansas ever. And it's consistent, it's clear, it gives us hints. I mean, it's giving us hints at if we're making our investments in the right place, is the way I see it. And over the 11 years, I agree at the beginning, like, ooh, yeah. I mean, these people signed up
want me to do
take
what?
care of kids, right? To invest in kids. But I agree with you that there's a change and a recognition that this helps us move forward at the local level. When did you ever hear a teacher who said, yeah, I'm really glad you told me my kids are low in fine motor skills. But I keep telling the classroom teachers, we got to let them have the glitter and the glue, right? And so those allow conversations to happen to maximize, because this group of people isn't going to make that change. It's going to be the people in the relationships in every town in Kansas. So I think the other thing I wanted to point out is the tools that you reference, class, IGDs, all of those. Those are really good tools that not only give a group like us nice bullet points with percentages at the beginning and measuring change, but also adds to those conversations at the local level and with families. Right? There's all kinds of politics involved when you're working with families and nuances, but if you're able to say, well, this was this snapshot, that's where family change, however you define family, can happen and improve. And then the final thing I want to say is the numbers are impressive. I mean, they're just impressive. Are they where we want them to be? Absolutely no. But we have to remember, this is not a longitudinal study. This is a year to year to year for us to determine if our investments are well put in the right place at the right time. And so I just think the design is good. I do think that any time that the group who works on this every day, eats, sleeps, and drinks this, thinks there's something we should add or change to the design, I think that's valuable for us as a board to say, yeah, that makes sense to us too. Because right for your example of justice involved, that's becoming more prevalent in research and evaluation and granting to say, are we including justice involved? But the ramifications of that, think about the local home child care provider saying, so have you guys gone to court lately? How are we going to measure that, right? And so I believe firmly in all of those things, but I just think that also that design can also impact the investment we as a board make with WSU. Right, so anytime we ask them to do something different or more, or I think it's all good. So I would encourage that as you see and hear things from people who are the professionals in this area and say, hey, here's an emerging trend we see, we think we need to measure this, we need to measure that. I'd love to hear those things as they do come up, because if you're doing the same evaluation design as you were 11 years ago, but you're not, right? You've adapted over the years. So, but the keeping it the same so that we can compare, like being able to see that beautiful, what you made look simple year to year to year, and it's not simple, that's valuable too. So, I think to the board, I would just say if we were always open to the team that we hire to do the work, I think that's a good move on our part.
I can tell you, we look at all the alternative measures every year just to make sure there isn't something better out there. It would be a tough discussion because of the lack of ability to compare. But I also have to consider the cost. Some of these are very expensive to administer. Some of them take a great deal of time, which a school district is used to applying measures and can be, they kind of have this, I'll do what you tell me to do attitude. But a home care provider, if you take a literacy measure and switch from a literacy measure that takes 15 or 20 minutes to one that takes hours, that's going to decimate them. They're not going to be able to collect measures. So we have to, it's a balance. And meeting the criterion for reliability and validity and the benchmarks is very expensive because that's a lot of research money. And so people will approach me about measures and I'll look into them, but sometimes they have absolutely no data to support them. And we can't, because one of the key components that I didn't mention is that the measure has to have established sensitivity to change, which is, I don't talk about it a lot here just because it's not something even the broader research community typically addresses. But if I don't use a measure that's sensitive to change, I'm setting them up to fail. So if we use the ASQ as an outcome measure, I would be setting them up to fail because it's a screener. It is not developed to be a measure that's sensitive to change. So it's complicated, and without giving you guys a master's degree in psychometrics, which I'm sure many of you would not enjoy, those are some things that we have to consider, but we also need to make sure that the data is reliable and valid, and so that's why we do have high standards as far as certification and training and making sure that they're applying the measure as it is intended. It's a standardized measure.
We can explore within the Early Childhood Data Trust ways that we might think about wrapping. There's a reason the Department of Corrections is part of that data trust, so we will explore ways we can factor in that kind of data. But we'll stop short of changing the RFP immediately, so that we can avoid the downside of that kind of question of families in these programs. So are there, Dr. Smith, and then we have some other really important business on the agenda, so we'll aim to start wrapping up this item. But Dr. Smith?
Thank you so much for that information. Also, someone who looks at research and information, I love the fact that you show the N. I cannot stand seeing percentages and there's no N. Because if it says 100%, it could have been 2.
Yeah.
So thank you so much for giving us a good sample size, because that's very helpful in terms of looking at this information. Just for my edification, for our understanding also, as you all look at kind of what are some of those outcomes that you're looking at, because you want to make sure it's valid, that you can follow it in a longitudinal manner. Is it every few years that you look at, okay, are there additional outcomes that we need to look at? Because also looking at your data is as good as the question that you ask. So do you all look at if there's things that you might need to add in because there's been societal changes, things of that sort? Because I'm very happy that you looked at social determinants of health, and also I'm trying to work into my own lexicon using social drivers of health as well as health-related social needs, because also recognizing that social determinants of health make it seem like it's finite as compared to no. Some of those things can change potentially for our families, such as they're able to move out of their community, so there's other opportunities for their children. So how as a group, because I also know research costs a lot of money, and when you are getting money from funders and you're changing things, you have to justify why you're making those changes. So how often do you all look at what are your outcome measures, and when do you decide to add in other things so you can justify why this is being added in to be looked at?
Always, constantly. I can tell you grantees will email me about something. Plus, when we do visits, sometimes they tell us about how things are going, and I get information so that I have an idea. During COVID, we switched. I was already a little unhappy with the measure that we used primarily with home visiting. It was the home, but it was becoming dated, and the people who developed it had retired, and no one was taking up the cause. So I didn't see any reason to believe that it was going to progress and be more timely. And so that's when we switched to the Parenting Stress Index, which is actually a little easier for grantees to collect. But I'm constantly looking. It's just, as I said, there's a lot of factors to take into consideration because I don't want to overburden them in order to show outcomes, but I also want a reliable, valid measure that's sensitive to change. So, and it also depends on the programming, because we really have to look at something that is a measure of those, it's a proximal measure of those distal outcomes. And for 0 to 3-year-olds, communication is the biggest thing we know of that is predictive of long-term outcomes. There's an IQ test that I used to give the littles that is, it took me a month to learn how to give it. It's called a Bailey, and it's kind of like me being an iPad where I had a suitcase full of toys, and I started on a certain item, and I had to go backwards or forwards and jump here and jump there. It's that kind of stuff, and that was, at the time, the most reliable measure of cognitive development. But, so it's just, but the type of programming that is being funded is also a big dictator, because we want it to be the best proximal outcome we can come up with that is feasible.
Thank you so much.
Sure. And
right,
if you
Lynn.
hear about any great measures, let me know.
As always, your presentation tends to stimulate deep thought and robust discussion. I would take that as evidence of the value that people see in not only the report that you bring to us once a year, but also the work you do in the field.
Thank
You
you.
and your team with the grantees. So
I'm
thank
very
you.
fortunate to get to do this work.
Thank you. Moving on, item 4 on the agenda, Child Care Capacity Accelerator. Melissa, you want to kick that off?
I will kick off by introducing Dr. Owen Cox, who you all have seen in a Zoom box on screen at prior meetings. And we will also hear from Sarah Gardner from the KU Center for Public Partnerships and Research team. Owen will kick it off with some of the data and metrics associated with our evaluation of the progress and impact of the Child Care Capacity Accelerator grants to date. And then Sarah will come in and give some insight into the kinds of programs that are in play funded by Accelerator funds. So,
All right. Thanks for that introduction, and thanks for having me here. So many of you will probably remember a little over a year ago, the Accelerator grants really kicked off, and that was part of a slate that was approved by you all previously. And so we now have a year's worth of data on those projects, and so we're going to give a little update on where we're at today. But first, we'll do a little bit of overview just to go over those Accelerator grantees and the purpose. So again, the primary goal of the Accelerator, the Capacity Accelerator, was to increase child care capacity across the state. And in particular, we wanted to focus on shovel-ready projects. The reason for that will become clear as we recognize that we had a small time frame with which to use the funds for some of these projects. And so we focused on new construction, also major renovation projects, as well as being able to provide some funds for startup operations as well. Okay, another key component here is that we used multiple sources of funding to be able to do this particular project. And so we really do have a group of braided funding sources. So the first one on there I want to call out is that we use some state fiscal recovery funds, and those were approved through the legislative process to be used for this project. We also received $31 million as part of the Child Care Development Block Grant ARPA funds, and those came over to this project from DCF. We had a very generous donation of $2.5 million from the Patterson Family Foundation, and we were also able to leverage some federal PDG preschool development grant dollars as well. And the reason I want to highlight this is both to obviously say it took all of these groups coming together to make this happen, but also to recognize that all of these different groups also had different requirements. So some of our reporting is based on what is needed for each of those funding sources. It also had different timelines. So some of those timelines actually just ended a few months ago, and so some of those projects themselves will have ended. Others are moving on in the future. Just a little bit of the sort of the nuances when it comes to how these reports are put together. Right, perfect. Okay, so all those sources together ended up being that $54.5 million in accelerator funds. Those were put forth to create 5,635 new childcare slots across Kansas. But I should highlight that we also had $58 million in matching funds from local community sources to be able to do this project. I want to talk a little bit here and pause just to think through that 5,635 new slots. Those are new slots, but those are also permanent slots. Those are slots that are going to continue on into the future. So it's not representing a one-time, we have one-time funding, but we don't have one-time slots. We have continued slots that'll continue to exist beyond this project's life. All right, thanks. Okay, so where did these funds go? What are they funding? They went out to 63 separate communities. All told, we had 96 total childcare businesses that were receiving funds through the project. You can see a little bit of breakdown there. We have a good amount of licensed centers. We also have family licensed childcare homes. We also had one small center pilot as part of this. And then we also had what we called 16 innovation communities. And these are targeted pilots, and they received some additional services around it. So they had some coaching, some peer support calls that they could join in on, and also a lot of technical assistance. It was a space for them to talk through their ideas, find support, also potentially vent sometimes to their coaches if they needed to, but we really were able to wrap around additional supports for those particular communities. All right, and this is a depiction of where those are at and a little bit of a breakdown of the types of geographical communities they're in. You can see we are spread fairly well across the state and fairly well across different types of urban or rural settings. All right. One more breakdown here, and this is just an idea of the primary piece of the project scope. So some of these projects actually had would be involved in multiple scopes, but the primary pieces where you see that 38% for new construction. So this is brand new construction. We also had 48% of major renovation projects, and these could be expanding existing childcare centers, or they could be used for other purposes like retrofitting other buildings, other different community spaces. And finally, that 14% were primarily geared to that operational investment for startup to expand capacity. Okay, well, where are we at today? This is as of our last reporting. We are actually in the process of receiving more reports this month, as a matter of fact. But as of our last reporting, we had an 83% average completion rate for all of the projects that receive accelerator funding. That includes 44 grantees who are already past that 75% rate, and we're excited that we actually also have 18 grantees who have completed their project completely at this point. And so those are fully ready to go. They've got kids in seats and are up and running in their communities. I should give a plug for the allinforkansaskids.org website, where you can get information on all of these accelerator grantees, sort of a little bit about their project and their descriptions, and also some of the completion rate dates. There's also a lot of other resources on that website, so if you're interested, I highly recommend checking it out. Okay, and so just briefly, what we have actually seen right now, again, to date, is that 2,613 new slots have been created. So those ones are out there and are providing services. We have 28 new facilities, so 28 new facilities for childcare and 46 major renovations that have taken place through year one. This has allowed those grantees to have 402 new hires into the profession, and you can see a little bit there about some of the increases we've seen in wages for those folks at those centers. All right, I'm going to now pass it over to my colleague Sarah, and she gets the fun part here to talk to you a little bit about some of our key takeaways. Oh, would you like?
I would just pause
Okay.
and see if anyone has questions for you on the numbers.
I don't have questions on the numbers, but I'm really excited by the numbers. I mean, we've never had this conversation in Kansas that I know of, so those are incredible numbers. Thanks for tracking them, and thanks to those out in the field who brought the $58 million to this shindig and are doing the work.
Yeah, absolutely. We're very excited when the numbers come through as well. We recognize that this is like a one-time opportunity that we were able to take advantage of as a state, and it's really fantastic to see it coming together. All right, Sarah, I'm going to toss it to you unless anyone else has a question.
At the risk of bring the legislative session to bear too soon, I would say it's one time in the sense of the source of the funding, but if we find that it's effective to have an infusion of money to build or renovate places to add more slots, we could potentially add state general fund dollars to maybe not 56 million, but there is the potential to replicate this if we wanted to.
I mean, what we find is most funding sources have limitations that do not allow us to use those funds for construction. This was a really unique opportunity to use this funding, which had that allowable use in this manner. And we also have the Capital Projects Fund from U.S. Treasury, which was a different form of ARPA funding. So, we've done all we can with those resources to follow the intent that you do one-time things with that one-time source of funding, but with funding that comes with permission to fund construction, we see value. We know how much demand went unmet because we granted all we had to grant.
Melissa, could you share with us the number of grant applications that were not funded because you had that limitation?
I will if you give me a minute. We have it on our website. I'll have to look it up.
Okay. My point is that the demand is still out there. The potential to expand this and do more is still there.
Yeah, I mean, I'm looking for the exact number. I would say we had 3 times the requests for funding as we had funding to give in just shorthand.
Christy.
Thank you, Mr. Chair. I would just note that it's interesting when we're thinking about uses of that money, you could actually double the number of children that you reach if that money had been, let's say, just $5,000 grant would have been awarded per family. Then they would have put it into the market, the private market, and then you would have had over 10,000 kids, double what we were able to do. So there are unique ways to expand without necessarily doing it a prescribed way.
I would just note that what we are doing is meeting the physical space needs that communities had and the staffing needs so that slots were available in those communities for parents to choose. So this is a nice example of the fact that there is not a one-size-fits-all solution that the state can enact from the top down and say, here you go, because you could give a parent $10,000 to cover the full cost. If there aren't slots available, they have nowhere to spend it. So we are trying to take a multifaceted approach to a multifaceted problem. So this is just one set of solutions. I mean, the cost of care is another facet of it. So we can have that discussion another day.
All right, thank you. I'm going to pass it over to Sarah.
Thank you, Dr. Cox. In my role at KUCPPR and why I'm the one delivering this today is because I have the great pleasure of supporting the cabinet staff in administering these grants, leading our innovation communities approach, and then also providing triage support for grantees. Who do they go to when they have a specific challenge, and how do we funnel them to the right support? So the way I'm going to structure my part today, and you teed this up really well about scaling strategies that worked, and so I'm going to highlight 2 broad brush approaches. One is community-specific solutions. Melissa referenced, it's not one size fits all, and the beauty of these funds is that they allowed a community to determine their own solution and then use the dollars to meet their needs. And we're going to talk through what that looks like. Also, state-level resources and targeted support. So I mentioned there was technical assistance around this project. We also had great partnerships with our childcare licensing team, our childcare resource and referral agencies, support on the ground. So we were able to bring those resources to bear very quickly, as opposed to having a community trying to stumble around and figure that out on their own. Next slide. So the first locally driven solution I want to highlight is a coordinated approach and partnership, and that we actually had a couple grantees who did this out the gate. So their application was one fiscal agent, one lead agency, and they funneled dollars to 8 or 9 different projects at the local level. Again, it didn't work for everybody, but it also worked in both urban areas and rural areas. It really depended on the collaborations that existed. A couple ones that I would highlight is we had several projects that were USD-led projects, so Unified School District-led projects. And the reason for this is rural areas and rural communities, and several communities, their USD is their anchor institution. It's their organization at the local level who has the administrative expertise and the capacity to actually manage a funding source like this and help distribute resources. Perhaps they have existing construction relationships that they can bring to bear. So we had several USD projects, not in just big areas. I highlight Neodeshe there on the screen. They actually had their opening this summer, so they are an open early learning center. The other thing to note with USDs is they were required to do full year, full day, birth through 5 slots. So this was something different than USD programming. It was related to them just being able to be the facilitator of meeting those early childhood and childcare spots. Coalition-led projects, we had several folks who took a coalition approach. Child Care Aware of Kansas has used the last couple years of ARPA funding to set up local child care coalitions to support them. And these are local champions coming together. Many of them are economic development led. They're led by the EcoDevo person in that area. And they brought resources together, people together, to submit a coordinated application. I want to highlight Reno County. They actually have a website, so if you have a chance, I would go visit it. They highlight the different projects that they supported. It wasn't just Hutch, it was the entire county that they supported. So that approach really worked for some communities. In-kind support, Owen mentioned the $58 million. It wasn't just cash support, it was a lot of in-kind resources. So we had communities that donated land, donated buildings. We'll talk a little bit about what that looks like. Really important economic development partners at the table. And then the final thing I'll note is it wasn't just social service sector and education that came to the table. We had a lot of construction partners and a lot of architectural firms who offered some in-kind services or offered discounted rates to help projects kind of get off the ground. Next slide. All right, leveraging existing assets. So I'm going to offer a couple different examples. One is in Sheridan County, a frontier county in Hoxie, 2 childcare facilities that they created using a duplex structure. So they had land donated by the city. They were able to create a duplex structure and license both sides into independent childcare facilities. They are actually licensed as family childcare facilities, which you can do. It's a licensed type. You don't have to have an owner-occupant living in the home. That can be a licensed type, and so the folks in Sheridan County did that. Pretty Prairie in Reno County, as I mentioned, Reno County's coalition wasn't just in Hutch. Pretty Prairie had no childcare slots at all in their community, and so they built a facility using a house, and they were able to renovate that house and turn that into, again, 2 childcare facilities to add slots for their community. If you go to that Reno County website, Pretty Prairie actually has a video on there, and it's really inspiring if you're looking for that. Okay, bigger community in Hayes and Ellis County. Hayes Medical Center had a space on their campus, actually donated that space, and were able to renovate that space into a 77-slot facility. And if you think about the needs of, the childcare needs of our medical workers and our hospital workers, a really big kudos to those in Hayes. Okay, we talk a lot about public-private partnership. Businesses are also coming to the table. Here's 2 really concrete examples. And the bottom part of these slides are strategies to scale, because again, it looks different, right? Not every employer is going to be able to do the things that these two employers are able or have been able to do, but there are lots of ways to approach business partnerships in supporting and expanding childcare capacity. So the one from Creekstone Farms, they actually had a project already started on their complex in Arc City, and so we were able to offer them some funding to get that project across the finish line, and then they are offering tuition support for their employees who use that childcare space. So it's a little bit of a two-pronged approach, helping get the facility off the ground as well as helping support the cost of childcare and helping reduce the cost of childcare. And then a project that hopes to open in next fall is in Crawford County, Sugar Creek Packing Company, again, using their complex and their space to offer support. They are managing the entire construction of a new childcare facility, and they are partnering with a childcare provider to come into that space and provide that care. So again, you're saying businesses can do this part really well, childcare providers can do this part really well. It's a really, really wonderful partnership. The other nuance about them is they hope to actually add slots that meet the needs of shift workers. So folks who are working third shifts, who, is childcare available at 9 p.m. in most communities? It is not. Spoiler alert, it is not available in most communities, but we're hoping in Crawford County it can be available.
Sir, a quick question.
Yes, sir.
On both of those projects,
Yes, sir.
are those entirely focused on the employees of those two entities?
No, in fact, that was a requirement of the Accelerator program is, yes, you can prioritize, you can support your employees, but the facility has to meet the broader needs of the community and open to the community. And I think that's a really fine point to put on how businesses are playing this role in the community. They're recognizing the role they have in the larger community and not just looking at their own employees, but they're looking at their role as being a stalwart in this effort at the local level. So really appreciate their partnerships. And then the last piece of the local level solutions is we had a lot of accelerator grantees who focused their work based on the needs at the local level. One size fits all applies to solutions. It also applies to the needs. There are some universal truths about lack of childcare across Kansas, infant care being one of them, non-traditional hours being another. But when a community really understands the needs and the preferences of the families in their community, they are better suited to find solutions. And that's exactly what our accelerator grantees had to prove in the application process and then have been sharing in the reporting process. So infant care, we had several projects who focused on adding slots for infant care only. We also have a couple projects that did incentives for providers to serve more infants, a la the Baby Steps program, which Child Care Aware of Kansas operates. We also had communities who built childcare close to USDs, and that's because, again, in maybe a smaller or rural community, mom is driving their third grader to school, also has an infant. How convenient is it to make one trip as opposed to going across town to two different places? So we had some communities that really looked at where's actually the geographic need for this new investment that we are making in our community. Non-traditional hours, I mentioned the Sugar Creek example. We also have an accelerator grantee in Douglas County who is saying drop-in care is really needed. We've got families who are dealing with emergencies. We've got sandwich generation folks who are dealing with younger kiddos as well as aging parents and taking care of aging parents. And they need space and flexibility to be able to take their child somewhere that is safe, somewhere that they are going to get a positive experience. So we have some drop-in care. And then additional on-site resources, we have a provider in Derby who's actually offering some on-site mental health resources for kiddos that are coming into their childcare space. And then the final targeted need is substitute care. This is more of a universal need as well, but it's really critical in communities where there are very few childcare spaces or childcare facilities, because if that provider is sick, if that provider has to go to training, if that provider has an emergency, it's really challenging to find someone who's available to come in last minute and keep those slots open. But the childcare needs are still there, and so we have a applicant or a provider who is standing up a substitute program. We're actually excited to expand that with our PDG funds too. Okay, those were my community-driven solutions. Melissa, did you?
Are you going to mention intergenerational care? If not, would you?
Yes, okay. Yes, intergenerational care. I mentioned the Hayes Project, and that is something that I know Derek has a background in, has a heart for, but this idea that you leverage existing spaces, including spaces where maybe there is an elderly care facility or a facility for seniors, and there is space in that facility to add a childcare classroom. There's just a lot of research about the positive interactions between seniors and younger kiddos, and so intergenerational care is one of the strategies that our partners in Hayes are using as they think about meeting the holistic needs of their community and leveraging existing spaces and assets that they have at the local level. So it's an exciting model. So in addition to community level supports, what resources did we provide as a accelerator team? How did we help folks navigate some barriers? So here are just some strategies that need to be considered as we think about what's next. We have a small center pilot going on. I think Owen maybe mentioned that earlier, so I want to just clarify what that is. It is a pilot license type that allows a facility to serve more than the 12 children that are currently allowed to serve in a family child care home with some of the same family child care dynamics. So you might imagine a space that has up to 24 kids, multi-age, that are not divided into classrooms. So that's kind of the big difference between a center and a family child care home, is you've got mixed age versus more of that classroom approach. In smaller communities, they don't have enough kids to populate 4 classrooms, but they need more than 12 children in one facility. And so this small center license type that the team at KDHE Child Care Licensing is piloting, we were able to fund one of them. We're funding an evaluation behind it to see the impact of it, but that was something that kind of came out of this process and the needs that communities were telling us. Awareness around the order of operations. We love it when folks have spaces that they're like, hey, this is vacant, we could do a childcare space here. There is an order of operations to make sure that project goes smoothly. So having your construction partner and your architect partner and your operator, your provider, kind of all in the same room with your Office of Fire Marshal, with your childcare licensing team out the gate will help mitigate any of those barriers that might come along the way. Oh, I didn't realize we had to have hand washing sinks that are this tall. I didn't realize we had to have exits in different places. And so really getting the order of operations right when you have a project is really important. That kind of comes to the next point too about converting existing spaces. So many well-intended donations, a church basement, a vacant dental office, which is one of our projects. It just takes a little bit of work to navigate, okay, how do we do this the best way possible? So we don't get in, tear down walls, have construction expenses, and then realize, actually, we needed that wall for safety reasons. So just kind of navigating the order of operations is really important. I think this is the best part of the accelerator, is we got to bring 63 communities together to talk to one another, and I know that they're still talking now to each other about what works and what went well. So it's one thing for us to document these strategies and convey them in a toolkit or a report. It's another for somebody who was boots on the ground saying, this is what I had to do, this is who I talked to, this is how I got funding, this is how I secured the building. Those kinds of peer connections are really critical. That actually helped us with leveraging shared service approaches. We have shared services across the state in childcare, so folks don't have to do the books and the HR and the enrolling and all the things by themselves. They can share that load with partners. The strength and the need for strong partnerships is really critical for communities. We talk about readiness a lot. The funding had a timeline. It had a window that it was open, and because the window to spend was also tight. And so we wanted to make sure communities were ready to do those things. And so they talked about, how did you get your partner, that partner at the table? How did you do that? And so we're able to connect folks to do that. Mentorship programs, CTE pathways, other workforce supports. Our workforce we don't have enough early childhood professionals in this state. So we can add the slots, we need to add the workforce as well. And these folks did a great job of saying, this kind of approach worked really well in my community. This level of incentive, this level of professional development support, this level of intense professional development support, because it came from them at the local level, they were able to help each other strengthen that and invest in that. I mentioned enrolling additional infants and toddlers in incentive programs, and these are showing some really good fruit, bearing some really good fruit based on the investments that we're making with the Baby Steps program. And then Reno County did this at the local level, Miami County did this at the local level to really help support getting those infant slots available online and served. Okay. So those are strategies to scale, things to think about. Wanted to also just call out some key takeaways on the lessons learned. So we're a year in. If we knew this back then, what would we do differently, right? Relationships matter. We had a lot of communities who had a lot of really good ideas, but didn't have the existing relationships in place to be able to launch those ideas, to activate on those ideas in, unfortunately, the limited time that we had available. So having those coalitions, having non-traditional champions for childcare, the business community, your economic development folks, your construction partners, your architecture firms, these are folks who they have proven that they care about these issues. And so how can you at the local level start to drum up some of those relationships as you go? Leveraging private sector and existing assets. I mentioned we had vacant buildings. The dental office was just fascinating to me. We have this building that is no longer being used. How do we turn this into childcare? And a lot of our civic partners said, let me help you do that. Let me help you make that affordable so that you can turn that space into something. And then these projects need some amount of time and they need some ability to be flexible as challenges come up. I don't know the percentage, but it's a very high number of our grantees had construction delays, just like anybody would during the end years of the pandemic and post-pandemic. Supply lines are delayed, and that impacted construction. And so we had a lot of folks who said, I'm going to open my doors this day, and had to push that back. And so childcare projects like this need that awareness of flexibility and good partnerships. And then just navigating those logistical delays and the ability to infuse and pivot quickly. So that's where I think the coalitions were actually better suited because they had the administrative capacity to manage the different funding sources, to manage the timelines, and to manage the different vendors. We have a lot of economic development partners who are wearing 7 hats right now because they saw the need for accelerator, they went for it, and they're still juggling with their day jobs, right? So as we support childcare projects like this, having that awareness that these are people who are wearing many, many hats at the local level, and how do we support them? Final thought as it relates to the importance of construction is that childcare providers who have a mortgage because they are a family childcare provider, have a lease because they are operating in a center, that is overhead that cuts into their ability to pay their workers higher and to lower family costs. When we take away that mortgage and that long-term lease, like a new building that is constructed and covered and just has the maintenance, it makes it more financially viable for programs and providers to be able to close that already very narrow, thin margin. So I think that is the one, it's not just the pretty space and the ribbon cutting, it's the ongoing cost savings to that provider who already has thin margins. So that's my presentation. I'd be happy to take questions.
Thank you. Any questions, board members?
Amanda, and then I have comment.
I think I think that we don't always take a beat or a moment to say thank you and to appreciate all of the incredible work that went into appreciating that construction and funds for construction is a whole different beast. And I just appreciate that I know that there were a lot of, yes, very creative folks at the community level who made that work, but also an incredible amount of staff effort that went into being able to bring people together and figure out how to navigate those barriers and figure out how to take these lessons learned so that we can take what we've done and take what we've been talking about for a long time, say, yeah, we know that construction is a barrier and facilities are a barrier, and gosh, we did something about it. So this is, I'm sorry, not a question, but this is a really sincere thanks to the teams at KU and the Children's Cabinet and KDHE who figured out how to make this happen because it was a huge lift. So thanks.
Thanks, Amanda. Yeah, thank you for acknowledging that, Amanda. That along the same lines, I want to say that the program design phase, we benefited from the expertise of a staffer who left us to go back to the private sector, but who had experience from the city perspective. Lucas Neese had helped in Lindsberg develop a child care project and helped us at that critical juncture. And then shout out to our team. I wish Megan was still here. Megan Broha from our team is the point person who interfaces with the grantees on a monthly basis regarding the invoicing. And I can tell you I have signed invoices that have a 6-inch stack of backup materials documenting how these funds have been spent. So it's been a heavy lift for her. Diyoga and Christy have also supported her. And for us at the cabinet, braiding multiple funding sources together that each come with a unique timeline and set of requirements, both on the allowable use side and the reporting side. We have 4 different places we have to provide reporting from our perspective too. And so it has been a uniquely different administrating process for us. And I couldn't have done it without not just my own staff, but the team at CPPR, because of the intensity of the TA and the mentoring that goes into each of these uniquely different projects. So I do want to acknowledge all of that.
Question?
Thank you, Mr. Chair, and thank you. This is such great information. I'm looking at Appendix A. And can you kind of help me read that? There's the column % of projects completed. So if it says 100%.
If it says 100%, then the project is done that they proposed to do with our funding.
Okay, so if it's 100% or 9, that's exactly what it says.
Yep,
So
doors
it's-
open, ribbon
It's not
cutting.
just for the year,
That's
it's
right.
complete.
That's right.
Okay.
That's right.
Okay, so then overall, is there any compilation of the data, like, okay, for those that are 100% complete, we projected these many slots, we have these many slots? I know it varies, but do we have that compiled
So we can go back, I think, Lindsay, to slide,
in column 4?
the last slide Owen presented, I think.
Oh, I'm sorry.
No, it's okay.
I might have been abs AWOL.
Yeah, no, I think it's where it
Okay.
bears repeating. So the 2,600 new childcare slots are what is, as of the date we compiled this report, these are slots online. These are, children are in these slots. And the difference between that number and the projected number, which was the 5,600 number, I think, that's what still is yet to be built and developed. And one of the factors of that is the main source of construction funding was the Spark 20 million. That funding has through the end of next September to be spent. And so a lot of programs that are engaging in brand new construction, who are using a good portion of those dollars, are going to open in the spring, in the summer, and into the fall of 2025.
And I would just point out that not every grantee got each source of
That's right.
funding. So we have some grantees that got maybe both the construction Spark funds and some of the major startup operations funds. We also have projects that only got the construction from the Spark funding. So it's why we have multiple different tracks in play right now. But
Yep.
we're pleased with the acceleration of ribbon cuttings, and we still have groundbreakings happening. So we've also seen projects run into just basic planning commission delays, the process to get the permits to break ground and do certain elements, zoning issues. So we're holding hands and helping people navigate as best we can through that.
Okay, well, that helps clarify. Help me with this, maybe a specific example.
Sure.
Maybe that will help my understanding. So like the Heritage Home in Wabunsee, it says it's 100% complete, but then the description says renovate and update. Has that happened? Because when I look at that and I think it's 100% complete, they've hired 10 people and they have 4 of 55 slots. So there's got to be further, and I know you can't include all of the explanation, but
Nuances is right. So we can look into that and get back with you on that specific example.
One thing I would say is it does take time to enroll, so they may have functioning, licensed, available openings and not yet enrolled. So it could be that 4 of the 55 have enrolled kids. It could be that they're 100% expended on our
That's right,
funding,
yeah.
but there's still work going on that some of their match funding is supporting. And that probably is the most common reason for some of the discrepancies.
I can comment on that too, Melissa. Their Heritage Home is definitely operational because I was there a few weeks ago on a just site visit because they're an intergenerational concept. They have a fully functional center, so they're up and going, and that's one I would urge visitation to. Aaron Steele's operator out there doing a great job. So they have a senior living facility in Alma, and then an intergenerational concept on basically a wing of that facility where they have kiddos coming in from the Wabunsee County area.
Well, in this report, the Appendix A is as of June 30th, 24. So more enrollment, more progress has happened since that date. This is the report on the first year. So there's been progress since that table was created. So keep that in mind too.
And just acknowledging the appendices, trying to be as clear as possible, but recognizing the 4 different funding sources have 4 different timelines. And when we say project completion, that is what they are reporting to us based on us as their funder. So if our relationship with them formally ended on 6/30 because that was the only funding source they received from us for this project, then it's not a formal, hey, we're going to continue to follow the project. We certainly will informally, but that's not included in this report.
I have a quick question as well.
Thank you. So any of the ones that aren't reporting yet and might be having hurdles that are, unforeseen barriers or challenges, if those drag out, I know some of the funding has a deadline. Will we at some point say, look, we've got a lineup of people here that are ready to deploy the funds? Do we have a plan for that?
Yeah, we have an obligation to ensure, we will be asked probably very soon by the Office of Recovery whether we anticipate any unspent funds for these federal dollars, because there's still a limited amount of time to reorient where the funds are encumbered. So we do keep tabs. We ask for progress updates from our grantees. On every invoice, they report to us progress made, and we've done site visits. We will continue to monitor. I follow. I just this week asked some questions about a subset of grantees that hadn't invoiced certain things in a certain time frame. So we are monitoring very closely and working with them. We also, within the program, I think if there's any money to recoup before it gets sent back to recovery office to go somewhere entirely different, I think we have existing grantees running into some cost overruns that would probably benefit if we had any money to reallocate. So that may be something that if there's an opportunity, we may be asking for approval from the board if it comes to that. I don't want grantees listening thinking that there's more money to come, but that we're looking at whether or not every dollar is going to be spent in the time allotted, because we want to make sure we're applying it where it needs to go.
Deanne.
Thank you. Just a quick question. Can you just help us understand on the slots that are projected? Is that data that was given by these organizations when they first submitted their proposals?
That's exactly right.
Okay.
That's what they projected to do with the funding. They had to tell us about their project. They had to give some very concrete details about the facility, how the facility would look. They had to give space drawings. They had to provide a lot of information to justify that count.
So when there's, some of these have obviously exceeded what they had projected. So, I mean, that's a huge testament to what they've been able to accomplish with this fund. So, do you have any comments just about some of those that have exceeded their thoughts? There are a couple of examples I saw, like learning experience in Blue Valley and Walnut Valley Learning Center.
So, I would say two things are a factor here. One is, construction plans can change. And once they get in with the licensing entity, they can co-create, like, actually, we can be creative here, and you could actually have a different count in this space. So there's a little bit of that once you kind of get on the ground. The other is some of these facilities might have had vacant classrooms that wasn't part of their proposal, but workforce shortages are real. We have classrooms across the state that are closed because there's not enough workers. And so perhaps they were able to recruit and retain workforce to be able to open vacant classrooms or even expand spaces.
Okay, thank you.
I would note that we have worked very carefully with grantees when there are amendments needed to their project plans, but the one thing we've held pretty firm on is that changes to design that reduce the number of slots were not acceptable. So you might see projects gain more than they wrote for, but we have sent people back into design phase to address, hey, your grant was supposed to generate X number of slots, so you can't reduce by 2 classrooms, we had some pretty tough conversations, but they understood, and I think in every case rose to the occasion. So we've got, you might change from a 2-story to a 1-story, which I think is probably better for childcare from a safety standpoint, logic and all of that, but maintain the same number of slots. I think the licensing changes have helped because we've seen, I did a site visit myself in Atchison with St. Benedictine on the little campus they're creating for early childhood, and they were really excited that they were able to add capacity across the number of classrooms that they're building. They did choose to make them a little bigger to add the space for more kids, but the ratios that they're allowed to have, I think they were really excited at additional infant and toddler capacity that they'll have. So, it's again unique in every situation, but in no case were they allowed to take all of the money they were granted and give us fewer new slots for their community.
We can't emphasize enough the importance of local level collaboration, to have all those partners at the table to help you navigate. So you don't ever hear a no, we can't do that. It's a, how do we do that? How do we think differently? And these grantees are testament to having the right partnerships at the table makes a huge difference. So, okay, thank you.
Further questions or discussion? If not, thank you both for your presentation, and the work is not finished yet, so I can assume that we will have a follow-up report at some future meeting.
We will continue to monitor progress and continue to keep you all updated. There will be a section in our annual report that speaks to both the Accelerator and the Capital Projects Fund, so stay tuned.
All right. Moving ahead to item 5, Early Childhood Advisory Council.
I think we can tackle this really quickly. Just a reminder, the Children's Cabinet was named through executive order to serve as the state Early Childhood Advisory Council. In our official capacity and in that executive order, we were charged with creating the Early Childhood Recommendations Panel to serve the purpose of meeting the criteria in the federal Head Start legislation that requires the naming of an advisory council. We, around this table, have a lot of expertise, but we don't have the specific roles and responsibilities outlined in the federal law. So the recommendations panel serves as a standing committee of the Children's Cabinet, and it is populated by members who do meet the federal criteria. To that end, every year in spring, there's an open application process so that people across the state who are interested in serving can apply. And at our June meeting, this cabinet approves the slate of members for the year that starts on July 1st to serve on the panel. We have had a change in personnel at the Kansas Department of Health and Environment. Amy Dean Kampmeyer is new co-director of the Bureau of Family Health, so she is stepping down from her role on the panel. And Holly Fry from the KDHE team, who is the home visiting unit manager, would be the replacement we're asking for approval to name. So I think that this is one of those that if there's, Mr. Chair, I don't know that we need, I just need permission to make this change.
All right, you've heard the request to make a change on the advisory council.
I'd move to approve.
All right, we have a motion. Is there a second? Motion and second. Any discussion? If not, all those in favor say aye.
Aye.
Opposed, no. Motion carried.
Thank you. In the interest of time, can our agency updates are important. Either speed read or I would invite a written update and we'll include them in the minutes. Okay. I do want to recognize Justice Melissa Standridge is newly assigned from the judicial branch to serve as the ex officio advisor. We want to thank Justice Wall for his year of service with us. We appreciated working with him and getting to know him better. Their assignments for the Chief Justice assigns to different projects. And Justice Wall is focusing on rural justice, and Justice Standridge, as I understand it, is very focused on child welfare and foster care and those issues. So welcome, and we look forward to working with you.
Let's see if I can. So I have one question. Am I, we're a branch of government, but am I considered an agency that does an update?
We would, any updates that from the perspective of the judicial branch that affect early childhood, families, the kinds of things that come up as subject topics here would be welcome. Sometimes we just ask for written updates if there are any, and when there's time on the agenda, we'll give you the floor.
Okay, thanks.
Yep.
Okay, we'll move on to director's update. Melissa.
I will keep this as brief as I can. I will start with the very exciting news that the Children's Cabinet application for the Preschool Development Grant 3-year renewal was approved. And it is big. And they approved us for the full funding that was available. So the budget we submitted and all of the activities in the grant application are part of that approval process. We'll be having some kickoff meetings with the subrecipients that were written into the grant program and the various agencies involved. But we are really excited to be able to continue with that work. The grant, we got about a week's notice. The grant officially began September 30th of 24. Will run through September 29th of 27 in 1-year increments pending federal appropriation of the funds. So every year we go through the renewal process, but we are really excited. We will continue to focus on the work that we began. It allows us to get to goal on the work, the child care workforce registry. We were going to have a functioning registry that would be an improvement, but now we get to do the really like all of the functions and all of the internal communication issues that make it fully functioning on our side as well. So licensing and childcare providers have that tool to communicate better. The quality improvement, professional development will all, it will be a resource that will be incredibly useful. There is a focus this round of funding on mental health related services. So we will educate you all more on the nuances of grant activities at later meetings. But just know that it's a wonderful opportunity. We also, a couple weeks ago, received the notice from the Administration for Children and Families of our annual Community-Based Child Abuse Prevention Award, CBCAP. We have been on a trajectory of getting a little bit more every year than we had the prior year. This year we got cut. So we had brought the recommendations to the board in August based on the hopefulness of increasing the award. We ended up having to revert to flat funding the roster of grantees to make the numbers work. We have adjusted. There will be, we are pulling about $82,000 from the infrastructure line item to cover some of the evaluation costs so that the funding can go into the grant awards from the grant that we received. We're trying to make it work. So we understand that this means the kind of growth that we had hoped providers applying to make. We've had to cut back some of those goals and try and do no harm to the services that they're providing. So that was disappointing, but our grantees are a good group, and I think we will continue to work with them hand in hand to make sure their programs have the impact that we hope. The PDG planning grant only has the outstanding work other than evaluation and certain wrap up is the Baby Steps program, the financial incentive for infant care, so that is on track. And you all will find a hard copy of our 5-year strategic plan. We brought you this. You had a digital copy at the August meeting for discussion and approval. This is the printed artifact. We did print some extras, so if anyone wants an addition, if you have reason to want extra copies, just let me know and we will make them available. I think I'll stop there, Mr. Chair. Those are the highlights. We look forward to bringing the annual report in December so that you'll hear a lot more about the whole portfolio.
Yes, Derek?
I did have one thing I wanted to make sure that you all saw was that childcare licensing application and background fees will continue to be waived. We got word from Governor Kelly that they'll continue to cover those through the end of calendar year 2025 or until funds are expended. So that was something I felt that was worth noting. If you get questions in your communities from the provider side, it'll continue to function how it has been functioning since 2021. So.
Thank you for mentioning. I should have mentioned that.
Can you tell us where we are on the? At one point in time, there was a backlog on background checks. What's the status of that nowadays? Ish. Not looking for super detail.
Yeah, no backlog per se that I'm aware of. What we found was seasonality plays a big role. So especially when our summer, our school age summer programs get rolling. I feel like this isn't working, but I'm going to keep talking. That's fine. I talk loud enough. So what we've been looking at in terms of the seasonality of those approaches in the coming years is just preparation for that influx. But we've also invited those programs in to discuss the fingerprinting background check process and had discussions with KBI2 about how to streamline some of that. But most of it's federal requirements and our current licensing system, which doesn't like to play nice. So, which we're excited to move on from in the very near future. We're continuing to design that new licensing tool as well. So a lot of cool new tools in the childcare space.
All right. Thank you. Yes, Monica.
We're all struggling with this, aren't Well, it's like a hand-eye coordination thing.
Yeah.
I was thinking about the justice's question earlier, and at some point in time, if it's ever appropriate, with both of you from corrections and justice, I'm happy to hear of more diversion type courts popping up around Kansas, around families, whether it be, you hear about drug courts, you hear about, family court, those kind of things. So if it's ever appropriate for us to know what the landscape is in Kansas, or if it is changing, maybe it's not, that seems to be a best practice that I hear a little more about.
So we did have an initiative, that kicked off this past month in September called Family Treatment Courts. And we have 3 pilot courts, that Cowley County, Miami County, and Lyon County. And they are like drug courts, except they're for parents who are dealing with substance use disorder, and that is the primary reason their children have been placed in foster care. So instead of, so there's been criminal, not necessarily criminal charges filed. That's the reason. So there maybe aren't criminal charges filed, but the children are taken from the home. These parents are seen every other week. And in the morning, there is a group of community support, from housing specialists to social workers to mental health providers, the judge, the attorney for the child, the GAL, the attorney for the parent, and they're all in there as a support system, and each parent comes in. And then that afternoon is when you have court, and the court is sync court, okay? Coming in, how are you doing on, here's what your targets are in order to reunify. So we did, because the legislature and then not KDHE, KDADS, we got, they included $5 million in their budget request. So just like Senate Bill 123, which in the criminal world, you have somebody who has substance use disorder, they go into treatment. Well, now we have money because most of these parents can't afford to go into treatment. So we did get $5 million to be able to put these parents in treatment. And then they're seen every 2 weeks by the same judge. So we piloted 3, and it's been, it's been in works for about a year and a half. I did that and, plan that summit at the same time. And so we're very, very excited about it. So that is news because we kicked it off last month.
All right, one final item on the agenda is looking ahead to the 2025 meeting schedule. And before we go to that, I want to make it plain that we would take input regarding this once-a-year in-person meeting. We would like your feedback on, is this worthwhile? Is it too much trouble? Is it not worth the cost and the time and the inconvenience, or do you value it? So please give us your feedback. But looking ahead, you see on the screen the proposed 2025 meeting schedule. As has been the custom, every other month, the first Friday. So look that over. If anyone has any serious conflicts with that, please let Melissa and staff know. Melissa?
I would just note that we looked at the calendar. Easter is late in 2025. It's end of April, so we're well clear of Easter weekend. I am cognizant of the fact that during February and April, you can't know if legislative duties will supersede. We understand that, but there's no perfect solution to that. So I do think if, do you have a comment?
Well, we have been given notice from potential leadership that the habit we've gotten into of having days where we don't work on Monday and Friday are coming to an end. So I do anticipate more Monday and Friday meetings, and so we'll just have to wait and see on those particular days. As to Mr. Chair, your comment, I think it's very important for us to get together face-to-face once a year. I think there's so much more side conversations, and just getting together, I think, is really good for the cabinet to be able to have more in-depth conversations, and I like it. Yes, it's an effort, but I think it's worth it.
Do we want to talk now about the month that we choose? Is that helpful to have this much forecast? Is October the right time? I know summer was, you kind of think, oh, maybe people are on a more relaxed cycle in summer. That did not prove to be the case. So I'm wondering if we want to target the October 3rd meeting this far in advance to see if there's a way to protect it on calendars.
I agree with the October date. I think it would be really helpful. I mean, the only challenge is it's so close to Election Day too, so those who are elected officials, might have some difficulty. So I would probably, ask our elected officials if it's tough. But I definitely feel like October is the best.
At least for next year, it'll be an off year for both House and Senate, so I feel pretty good about it for 2025. Okay, so traditionally we ask for the members to vote to adopt the calendar, Mr. Chair.
All right, I would entertain a motion to adopt the calendar for the coming year.
So moved.
Motion, is there a second?
I'll second it.
Motion's been made and seconded to adopt the calendar as shown on the screen. All those in favor say aye.
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 Opposed, no. Motion carried. Any further business, Melissa? Nope. All right, well, thank you all. It has been a full morning. And kind of had to scramble at the end there, but we got through it. So thank you all, and thank you for making the trip to Topeka. We certainly do appreciate it. With that, I declare the meeting adjourned.